Hello, welcome to this month's video teaching of Safe Space Community for Asians. SSC offers holistic remedies for emotional and mental difficulties from the medical, psychological, spiritual, and relational perspectives by integrating psychology and theology. This is session number 3. I am Dr. Edmund, a licensed psychotherapist, and I am your facilitator in SSC. The title of today's topic is Suicide Prevention, Intervention, and Postvention. You will learn first of all what is the difference between suicide prevention, intervention, and postvention. Then what are the suicide prevention strategies? And you will be given a handy checklist for intervention during a suicide crisis. And finally, you will be taught the suicide prevention techniques. These techniques are for both the suicide survivor and the bereaved loved ones. I'm aware that the term suicide survivor is used quite widely to cover all those who are affected by a suicide. But here, I am making a distinction between a suicide survivor to refer to those who survive a suicide attempt, and the bereaved loved ones as referring to those who are close to the person who died by suicide. Now, let me have a quick word on the world's statistics on suicide. It is estimated that all over the world, there are close to 1 million suicides annually. And out of all these successful attempts, there may be as many as 20 million attempted suicides. And the people, the close ones, the loved ones, and the family members or relatives who are affected by the suicide may be something like 120 million. And where is suicide most common? In Asia. It is estimated that 30% of all suicides in the world occur in India and China. And males overall die by suicide 4 times more than females. And what are the religious and legal views on suicide? The major religions of the world are against suicide. In Christianity, one of the 10 commandments of the Bible is that you shall not murder. Suicide is considered as self-murder. However, there is no scripture that explicitly prohibits suicide. And there are some countries that still have penal laws to publish offenders of attempted suicides. In other words, if a person still lives after attempting a suicide, he can be imprisoned for that offense. Nevertheless, certain religious and legal institutions are compassionate towards suicide on grounds of impaired rationality. In other words, where there are high emotional stress or intense suffering due to medical or mental health problems, these people who kill themselves are seen to be not knowing what they're doing at the time of their suicide. So what is suicide prevention? They are the community-based strategies and actions to reduce suicides and attempted suicides. This is in contrast to suicide intervention, which are the short-term care and treatment of persons actively experiencing a suicidal crisis. And after that, we have suicide postvention. These are the assistance and support given to survivors of suicide and the bereaved loved ones of those who died by suicide. So let us start with suicide prevention strategies. The first one, suicide and depression are interrelated public health problems. So when someone is having high anxiety, and if that anxiety is not treated, this can progress to depression. And when depression is left untreated, it can progress to suicidal ideation. So we need to create public awareness of depression as treatable and suicide as preventable. We need to reduce public stigma of mental illnesses and encourage people at risk of suicide to seek help. Secondly, we ought to minimize sensation reporting of celebrity suicides. Newspapers ought to link suicides not only to the immediate stresses, but also to the mental illness or substance abuse, and definitely not as something glamorous or trendy. Third, there are the gatekeepers. Who are the gatekeepers? Gatekeepers are people first in contact with vulnerable individuals, like the caregivers, the teachers, the religious leaders, the social or community workers, and the family members. Their role is to identify risk behavior, and this is covered under the next section, intervention checklist. They need to identify at the early stage and facilitate the pathway to good mental health care. Next, facilitating suicide screening. Loved ones and friends should encourage those at risk to do suicide screening. And let me give you an example of a quick suicide screening that each of us can do. Just asking any of these 4 questions. First, in the past few weeks, have you wished you were dead? Or in the past few weeks, have you felt that you or your family would be better off if you were dead? Or in the past week, have you been having thoughts about killing yourself? And number 4, have you ever tried to kill yourself? If the answer is yes to any of these 4 questions, then you must immediately proceed to the next section of suicide intervention and apply some of these items there. In fact, if the answer is yes to any of these above 4 questions, then you should ask question number 5. Are you having any thoughts of killing yourself right now? If yes, please describe. So the next thing that we need to take note of and practice is to have public policies that include reducing access to pesticides, securing common jump areas, especially the breaches, restricting firearms, and potentially lethal medications without prescription. I know of a college where one of the high-rise buildings is a regular site for suicides of students who are disappointed with their exam results. And so to prevent these students from jumping down, they built a barrier in their high floors so that students cannot jump down from the balconies. Another thing that the community can do is to educate doctors and professionals in primary care to know how to recognize and treat depression and related disorders, because there are just not enough mental health caregivers and professionals around us. We can also impart skills on problem solving and critical thinking, including looking at situations from different perspectives, and encourage those at risk to adopt spiritual worldviews in their attitudes towards life. And this is covered under the Postvention section. Another item covered also in the Postvention section is this, that suicide survivors often experience recurrent thoughts, and loved ones usually harbor a lot of guilt and shame. They need longer term and more specialized training. So now let us look at the suicide intervention checklist. First of all, we need to assess what are the general risks that prompt people towards suicide. At the individual level, previous suicide attempt is one of the main predictors of an impending suicide, of the next suicide, because having tried once and they did not succeed, they are very likely to try again. And we have mentioned before, mental illness, especially depression, Then social isolation, people getting very lonely, especially when they are dependent on their spouse and their spouse has died. Financial, legal, and criminal problems, job problems or job loss. And nowadays, we see many young people, young adults who cannot take all these problems. And because of lack of experience in solving problems and their low level of resilience, they often take the easy way out and kill themselves because they do not see hope in the days ahead. Or serious medical illness, when the pain is so intense or there's no hope for a cure, then people want to find relief by just jumping down from a high floor. Then there's substance abuse, family history of suicide, adverse childhood experiences, especially sexual abuses and so on, right? And there are many cases that I come across where it was told to me that these people has been so tortured by evil spirits, prompting them to kill themselves. And spiritual oppression is very real, especially in Asia. What about from the communal aspect? Of course, there's this bullying, there's sexual violence, relationship problems like breakups between boy and a girl, loss of a loved one, excessive shame or stigma. And there are many cases in this COVID era that people, after having infected by the COVID virus, they were stigmatized, they lose their jobs, and being so despaired, they just kill themselves. And in Asia, there are some cultural beliefs like ritual suicides that prompt people towards suicides. And we are familiar with harakiri in Japan, where people just kill themselves because they were dishonored or it is just a death sentence that they have to face. So easy access to lethal means, and finally, imitation of media suicide portrayals. Now, secondly, we need to assess the major psychological indicators of the individual. Is the person impulsive or have aggressive tendencies? A person who's in pain, seeing the window open, and they just run to the balcony and jump down from a high floor. So many of these people, because of the impulsiveness at the time of pain, they just take the leap. Deep sense of hopelessness can be very powerful. Inescapable loneliness, intolerable emotional or physical pain, strong desire to join a deceased loved one, especially in the initial few months, and compulsion to get even so that another person feels guilty after the suicide. This refers to a weaker party who cannot get even in certain conflict, and so they kill themselves to make the other person suffer from guilt because of their death. And you can check for the warning signs. Is there a threat to kill oneself or disclosure of such intent? When somebody says, I feel like killing myself, we must not take it lightly and brush it off. Oh, it's just a passing thought, right? A passing feeling. You will feel differently tomorrow. We should ask, can you tell me more about this feeling? Or what triggered this feeling in you? Another warning sign is the disposal of valuable possessions and putting personal affairs in order. And if you suddenly buy some little drugs or keep a rope in the bedroom or sharp objects or insecticide, right? All these are very clear warning signs of their intentions. And then there's excessive alcohol consumption because of frustration or boredom and so on and so forth. Frequent visits to the grave of the deceased because the grief is so overwhelming to them, and highly preoccupied with the death anniversary of loved ones. So these pains should not be underestimated as warning signs. And what we need to do, of course, creating the rapport is very important. So we have mentioned before, we need to take every threat of a suicide seriously. And we need to convey serious care and concern to the person by listening actively, listening empathetically. And that is to validate their feelings, their pain, what they're going through. Asking direct questions, not beating around the bush. Avoid safety and assess the safety and the danger factors. So we need to keep the individual safe, right? The safety factors such as remove little means of self-harm, restrict access to jump points, like locking the balcony doors and windows. Tell loved ones who can keep them safe and under watch. In other words, there has to be a commitment to call you before when they're having this suicidal impulse. And we have to make sure that if the caregiver is not available, then at least there must be a family member or relative that they can call, even in the odd hours of the night. So get commitment not to self-harm. Then during the crisis, time of crisis, right, when we talk to the person, we need to discuss directly the suicidal tendency. Validate their pain. Feel what they're going through. Don't brush it off. Right? Identify what is the precipitating factor. So what triggers that prompts them to jump or to take whatever actions to kill themselves. Take the person on a trip of logic, because when a person is so overwhelmed by the pain, by the suffering, right? They would not be logical. They would not think rationally. So you have to ground them to some certain extent of their senses, like asking what you hope, what you want to accomplish by killing yourself. Do you really want your children to be left without a father, for example? Then we try to normalize the situation, including talking about problem solving. How about this? Doing something like this, taking small steps, right? Offer constructive alternatives. Instead of killing yourself, can you not try doing this, right? So help them to ease off. Just extend your hand and hold my hand as a small step, right? Then point to God as the ultimate source of hope, right? Without saying too much, but just say, there is hope ultimately. And there's some general rules in intervention. Always remain calm, supportive, and hopeful. Do not lecture, never do that. Do not judge, do not blame. Never say it is stupid thing that you want to do. That is very judgmental, and never blame them, never criticize them, and do not start to preach to them. Recognize your limits and know when and how to refer for professional help. The cardinal rule in suicide intervention is always to do something immediately, right? Never put it off. Never leave a suicidal ideation unattended. So let us talk about some of the suicide postvention techniques. And we start with the techniques for the suicide survivor. First of all, we need to maintain safety measures and treatments. The safety measures are covered already in the checklist under suicide intervention. This includes getting the person at risk to commit, either verbal or written, right, to call you when there is a suicide impulse. And we need to ensure that proper medical and mental health treatments are continued to reduce the level of suffering. And the person is cared for physically and emotionally. Now, if depression is involved, you can watch our teaching video number 1 on addressing depression. Number 2, we need to impart a paradigm shift of identity and self-worth. We help the survivor to know that each of us is an unique individual with intrinsic self-worth. It is not dependent on our performance or on the opinions of other people, what they think and say about us. As such, each person is worthy of respect as a birthright. And we need to help them to believe in a higher force bigger than one's mortal self, because we are wired to be dependent on our maker, our creator, and interdependent on others. So believe in a God who is in control and cares for us. Then commit to him your concerns and let him take charge of your life instead of depending totally on oneself. This will take a lot of load out of the person who sees utter hopelessness for their individual lives. Number 4 is to involve in something that is beyond one's self-interest. In the Bible, there's a story of the prophet Elijah. He also wanted to die. Well, God gave him an assignment to anoint 3 persons for his purpose. And God, being our maker, he knows our human nature and how to deal with it better than any of our human techniques. So we need to be involved in something bigger than ourselves in order to live a purposeful and meaningful life, to direct us away from our self-centered hopelessness. Then we need to encourage them to take every setback as a learning process. Failures, setbacks, despair, they are not markers of who we are, but they are indeed opportunities for us to learn and improve. They should spur us on to take stock and improve on the quality of our core self, as our character is the only thing that we can take along with us when we die, not our successes or reputation, experiences, pleasures, wealth, power, and other earthly pursuits. Then for people who are oppressed by the evil spirits to kill themselves, deliverance is required to set them free. But when spiritual oppression is persistent, despite the deliverance, and the Bible tells us that, when a person's body, self is cleansed, the evil spirit who went off may even take in more evil spirits to further torment the person. So when this happens, I find that the courts of heaven approach to remove the footholds within us may be helpful. This is from my personal experience. And you may read more about this in Robert Henderson's book, Assessing the Courts of Heaven. What are the postvention techniques for the bereaved loved ones, the family members, and the close friends and relatives of the person who died by suicide? Our video teaching number 2 is the Jesus model for grief support in the form of the time technique. T is telling the loss, I issues to be resolved, M meaning to be sought, and E is ending and referral. So the same approach is applicable for suicide postvention for bereaved loved ones. However, these bereaved loved ones have enhanced manifestations that are over and beyond their normal grief symptoms, and they require certain focus techniques. These more unique symptoms include intense shock, disbelief, and horror. Right? We just classify them under trauma. Then there's intense guilt for not seeing or acting on the signs and preventing the suicide. Then they are always seeking explanations and meaning, the whys and the hows. And in addition, there is anger, loss of trust, social ostracism, especially blames from in-laws and others, and there's shame and rejection, resulting in some form of self-imposed isolation, especially for the family members. And they may experience increased suicidality. This is because of factors like shared genetics, living in the same environment of the one who died by suicide. There are the similar stresses around. And of course, there is a role modeling effects of the suicide that has taken place. So let us look at this one by one. Number one, the trauma reduction. We can do exposure procedures to desensitize those intrusive replays of the death scene. And how we do this, we ask the person to talk about it in detail, to re-experience what the person has gone through and to verbalize those emotions so that they can normalize those experiences. Then we can encourage cognitive restructuring to reframe negative thoughts. Instead of thinking negatively, we give them an alternative, right? To think of things that are more positive. And there are breathing and relaxation exercise because they are very tense, arising from those trauma, right? Ask them always, when they feel very stressed up, to breathe deeply, to relax the muscles so that they do not get very anxious or even get into panic attacks. And one of the useful techniques is to practice mindfulness, like meditating, to be present with oneself and meditate on the scriptures. And one good scripture that we can use is this Philippians. In Philippians, do not be anxious about anything, but in every situation, by prayer and petition, with thanksgiving, present your request to God. And the peace of God, which transcends all understanding, will guard your hearts and your minds in Christ Jesus. Next, how do we resolve the intense guilt that one harbors? Of course, we need to start by validating their need to review their actions in coming to terms with what has happened, all the whys, whose fault it was, how can it be prevented. So don't brush off those feelings and thoughts, although they may be irrational. So we facilitate the bereaved person's own trial to see if he or she deserves to be convicted by a test of rationality. This is because after something so tragic that has happened, they would always want to find a source of blame, right? And the easiest person to blame is themselves. What if I've done this? What if I've not done this? Right? These are all this make them convenient targets of blame to be held responsible, right? So that they have a handle to hold on, right? And we can help them slowly, help them to make sense that it is not totally their fault, right? That they need not harbor all the false guilt for themselves. So real guilt is resolved through confession, seeking forgiveness, and facing the consequences. How do we help them to reconstruct their meaning, right? First of all, we help them to learn to accept a less than complete understanding of the suicide. Because if they keep on speculating, it will not come to an end. At best, it is only a speculation and will not make any difference to what has happened. So develop a believable enough narrative of the suicide and the bereaved's accountability in it to minimize the stigmatization of the suicide. One way is to tell the story, re-story the suicide, like stating, well, I did my best under those circumstances. And find a neutral interpretation of the act of suicide. For example, well, he was very depressed and he was not selfish to take his own life. He just was not rational in that moment of stress or emotional pain. So separate the feelings about the suicide from the feelings of the life of the disease. For example, even though he killed himself, he was a good and kind-hearted person. Number 4, how do we help them to restore social reconnection because of the self-imposed isolation and social ostracism? It's good for them to seek counseling to resolve the emotional and cognitive issues. And you can also watch the video teaching under the Jesus model on issues to be resolved. And help them to focus on the post-traumatic growth, like becoming more compassionate, reorder priorities, serve themselves, and so on. Because as a caregiver, in cases like suicides, you will often be asked, how can any good come out of this, right? So we need to redirect their focus to something that is more positive, like making all this experience more productive on them. So re-establish family daily rituals such as having meals together and outings together, because of to reconnect socially. Reconnect initially with significant others who are more understanding and empathetic and not judgmental against them. Now, finally, attending to increase suicidality. Family members who may run a bigger risk of themselves committing suicide after a suicide has happened in the family, right? So the same postvention techniques applicable as in suicide for the suicide survivor are applicable to these bereaved loved ones, right? Such as impart a paradigm shift of identity and self-worth, believe in a higher force bigger than one's mortal self, involved in something beyond our self-interest, and take every setback as a learning process. So we have come to the end of this teaching session, right? If you want to read a real case of postvention of a suicide survivor, kindly refer to our SSC blog entitled From Suicidal to Living with Purpose and Hope. And the link is given here. This video is made to facilitate our Saturday morning community conversations. If you have any questions related to the teachings here, you are welcome to talk about them and ask questions when we meet over Zoom. To receive our latest blogs, emails, monthly video teachings, and the links to our weekly Saturday morning chats, kindly subscribe to our website. We look forward to seeing you again, and bye for now.